Okay, hi guys. So, probably the worst thing when we deal with chronic back injuries is the fear and the kind of the horrible, depressing mindset that comes with it, because you kind of feel like you're stuck like this forever and it's never going to go away and you've got no power, no control over it. Reality is, unless you're very, 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 very unlucky, 99.9% of the time, we can definitely start to improve the issue and get you out of trouble, but it's subject to us doing thorough investigation first and before we start to put a rehab plan together. So things like scans and reports can kind of, they'll help us kind of further evidence, but not the biggest, most important things, certainly not the only things we need to look at. So I'm a big believer in McGill's approach of provocation testing. So that's basically a series of tests that we can run that test particular movements and positions and loads that tell us exactly the type of damage you've got present, but also the kind of movements and postures that aggravate your back pain. Because one of the key things we need to do is, when we understand the mechanics of what's going on, if we want the pain to settle and the back to start recovering, we need to stop doing the things that are creating the problem in the first place. But we only know what those things are if we do some thorough investigation. So provocation testing is a good way to do that, and it starts to get that clarity. Once we have some clarity and understanding, then we start to feel more confident over our injury, because we've now got a bit of control and we can see a bit of cause and effect. So one of the things we'll look at today is the slump test. Probably one of the most important tools that we've got for provocation testing, because sensitivity to flexion, things like disc bulges, herniations, sciatica that are caused by an impingement from a disc bulge or herniation, are all going to test positive on this test and give us quite a very clear indicator, a very clear result as to what's going on. So again, that then dictates what exercises we can and can't do for you going forward, but also gives us an idea that we can then start to look at potential aggravators with your day-to-day posture and your movement habits, that if we successfully manage them enough and reduce them enough, that disc bulge, that herniation will start to heal and that sciatica will start to settle. So the slump test is one of a few tests that we can run, but it gives us some clarity with that relationship between compressed flexion and your injury. So not everyone gets a positive result, but those that do get a positive result, we know from the result of the test, we need to be careful of compressed flexion for you. And if we want your injury to heal, we need to manage and remove it and let things start to settle, and that will give the back a chance to kind of heal up and start to get us on the right track. So again, before we do anything, and if you want to get rid of that horrible feeling because you don't know what's going on with your back, you've got no control over it, you must do some thorough investigation first of all. So provocation testing is a very important part of that, because it helps us just zero on exactly what's going on, and we can disregard the other stuff that isn't important and just focus on the things for you that we know are going to improve your back injury and get you out of trouble. One of the first tests we can run is what we call a slump test. That's if we expect or we kind of predict that someone's got flexion sensitivity or intolerance. So this would come up in cases where people have got a history of disc bulges, herniations, and also things like sciatica as well. So what you need to do is get a firm surface to kind of sit on, which could be a chair. I'm using the bench here. Make sure if you do use your chair, your back isn't up against the support. Make sure you come away from it so we can get into the right position for the slump. So what we'll do first of all is, what I do is get people just to sit down first of all and notice if they get any catches in the sitting down process, because then that could be an indicator that just that standing to sitting, there's a problem with their technique and they've potentially got an aggravator there that we can iron out, and already that's one thing that we're going to sort of start to win to let the back pain settle. But when we get down, we do the slump test. We just see how people initially feel just being sat like this, see if there's any change in their pain at all, better or worse. And then what we're going to do now for flexion tolerance, I like to bring people's legs together, and then we're just going to try and round out. So we're going to try and tuck that pelvis a little bit and round out into a horrible slump position as much as they can get to. And we're going to see how they feel in that position. So does that change the pain, better or worse? But also that process of moving into that position, do they get a little, like a little catch as they move into? If they do, in that movement into flexion, back into extension and vice versa, that could be a sign that they've got a loose joint in there. So obviously stability is going to be play a big factor in their rehab process. But if they get into that position, there's no catches on the way, but just being in that position makes them feel a bit grouchy, a little bit sensitive, then we know flexion on its own is a little bit sensitive at the moment for whatever reason. Now we need to do a bit more investigation. So we'll go into that slump position. We're going to grab the bottom of the surface we're sat on. So again, it could be a chair. And we're going to gently pull in. Now we're going to add compression to that flexion. So if you're someone who's got sciatica, that's coming from a disc bulge or herniation, being in this position and adding that compression is going to compress the front of the disc. It's going to force that nucleus out towards the rear of your nerve root. So you've got a disc bulge or herniation that's causing a sciatica. You should feel in that flexed position with that addition of compression, it's going to sensitize your pain a little bit. And that's an indicator then if we're in that position, we have got a live disc bulge or herniation that is in fact impinging on the nerve root. Now what we can do now for a bit more investigation, what I like to add on, is I like to get people to sort of be in that position and then bring right shoulder to right hip and pull in, and then go left shoulder to left hip and pull in the same way. So I'm basically buckling laterally this way and then that way and doing that same compressive test. So I use that for a couple of reasons. One, it might tell us that for example, if we buckle towards the left, we get an increase in pain. That tells us that your bulge or herniation is probably coming out towards the right. But also, it just gives an idea of what your potential pain triggers are day to day that you are not managing. So if you've got a problem with lateral stability and you buckle to one side and it's okay, you buckle to the other, it's, oh, you get an increase in pain. We know somewhere you've got a lateral stability issue where you tend to buckle this way. So we can work backwards then and find out kind of in your day-to-day habits where that occurs. So again, slump test, it's not the only test we run, but it gives us a good example, and it also lets us understand the pain that's going on, because the big thing to do with this is understand that pain. If we understand it, it takes away all that confusion, it takes away all that kind of, you feel like you're overwhelmed, don't quite know what's going on. If you can understand your pain, understand your triggers clearly, you start to realize you've got some control over it. And once you realize you've got some control on it doesn't seem quite as scary. The future looks a bit brighter. And also then we know going forward that with your movement habits, we need to be careful of too much flexion, especially compressed flexion. And then we need to train your spine to help kind of reduce and control and protect you from those positions. So that gives that disc injury or that unstable joint time to heal, kind of shore up, become more solid, and let your pain subside. So again, we don't need to guess, we just need to run through very specific tests to see what your mechanical triggers are, and then from there we can work out what we need to avoid, but also it helps us form the rehab plan going forward. What do we need to focus on for you? And that really is the key, is to have a tailored program to your specific injury. We've got far greater chance of success and also long-term success if we know exactly what the problem is before we propose a solution. So again, knowledge is power. So if you understand your injury from the get-go with some thorough investigation, mentally you're going to feel a lot better about it and less sort of, depressed about the whole situation. But also we're going to know straight away what we need to avoid and what we need to work on for you to get you the best result.